Welcome to the deep dive. Today, we're digging into a collection of sources. We've got articles, reports, notes, all centered around, well, a pretty serious theme. Product safety incidents coming out of China.
Yeah, it's quite a range of material we've got here. And it covers, a surprising mix of products, everything from food like milk and seafood.
Right
through to essential medical supplies, things like plastic syringes.
Exactly. So our goal here, looking through these sources, is to really unpack the key insights. We want to try and understand the patterns, maybe some of the underlying reasons for these issues, and importantly, figure out why this matters to you listening in, especially in, well, this very globally connected world we live in.
Okay, let's get into it.
All right. So looking at the material, one major event really stands out as a starting point, something that kind of threw these issues onto the world stage.
Do you mean the 2008 Chinese milk scandal?
That's the one. The sources really zero in on it.
Absolutely. It's definitely presented as a pivotal moment in the sources. And the timeline they lay out is quite revealing. You had complaints about babies getting kidney stones starting way back, actually, late 2007.
And then that really significant online post, remember? May 2008. A mother whose child got sick from milk that was actually donated to earthquake orphans. That seemed to really galvanize attention.
Yeah, that was a key moment. The main company, Sanlu, they did eventually order tests.
But not until August 1st, right? That's when melamine was confirmed.
That's right. And this is where the sources highlight some, let's say, pretty troubling details about how it was handled initially. August 2nd, Sanlu's board decides on this trade recall.
Okay.
But the sources state they deliberately didn't tell wholesalers the milk was actually contaminated.
Wow.
And what's more, the Shijiazhuang deputy mayor was apparently in that meeting.
Yeah.
And the sources quote him instructing them to shut the mouths of the victims by money.
Good grief.
And also to wait until the end of the 2008 Beijing Olympics to end smoothly, and then the provincial police would hunt the perpetrators.
Wait until after the Olympics. That specific detail, it just jumps out. It sounds like prioritizing image over health, frankly.
It certainly seems that way,
Yeah.
based on the source material. And the whole thing didn't really break publicly until Fonterra got involved.
Ah, the New Zealand company. They were part owners of Sanlu, weren't they?
Correct. They were alerted in August. They told the New Zealand government. And then, according to the sources, New Zealand officially confronted the Chinese government September 8th.
And that's what finally led to it all coming out September 13th.
Seems so. And it became clear very quickly this wasn't just a Sanlu problem.
No, once the government inspection started.
Exactly. They found melamine in products from 21 other companies, including some really major players in the Chinese dairy scene, like Mengniu and Yili. Big names.
So let's talk about melamine itself for a second. The sources explain what it is, right? Its main use is in plastics manufacturing.
Right. But in this case, it was being added basically as a fake protein source, non-protein nitrogen.
A cheap trick, essentially, to make the milk test as having higher protein levels.
Yep.
Because the price paid depended on protein content.
That's the explanation given in the sources. Right. And the danger, which the sources detail, is that melamine can react with cyanuric acid, often an impurity in the chief stuff inside the body.
Forming crystals.
Yeah, insoluble crystals. They build up, cause kidney stones, and can ultimately lead to kidney failure. And it's stressed in the material. Definitely not approved for food use by the WHO or anyone else.
So why use it if it's unapproved and dangerous? The sources seem to point towards, well, economic pressure.
That's the strong suggestion, yeah. Fierce competition in the dairy market, rising costs for farmers' feed, livestock facilities, and on top of that, government price caps on milk. The sources paint a picture of processors being really squeezed, creating this intense pressure to cut costs any way they could.
Including illegal adulteration?
Apparently so. Yeah. Using things like melamine as a cheap filler.
It's a grim illustration of how economic forces can collide with public safety. And the human cost. Just awful.
Devastating. The sources mention Reuters figures from late September 2008, putting the number of affected children near 94,000 based on local reports.
They even break it down by province sometimes, don't they? Like over 30,000 in Henan, nearly 16,000 in Hebei. Just staggering numbers.
Yeah. And what's also noted is that the government then decided to stop releasing updated numbers.
Yeah.
The justification reported was that it wasn't necessary because it wasn't, an infectious disease spreading. But then there was that 2010 study mentioned in the sources. Quite sobering. It found 12% of the kids affected still had kidney issues 6 months later. Raises real questions about long-term health impacts.
just heartbreaking. And that really drives home the point the sources make. This wasn't just some isolated failure. The milk scandal, it kind of ripped the lid off deeper systemic issues.
That was the core argument, yes.
Yeah.
The scandal was like a lens, magnifying these underlying problems that, according to the sources, have been festering for years.
Like ignored warnings, for instance.
Exactly. The sources bring up this agent from Shaanxi Jinqiao Dairy. Apparently, he'd been voicing concerns about additives since maybe 2005, 2006.
And his complaints to regulators just went nowhere, even after CCTV aired footage showing adulteration.
That's what the sources report, which leads into this broader critique of the government structure that you see in the material. Analysts quoted suggest the party's need for control over the economy, over information flow. It actually undermines the independence of the regulatory bodies.
So it's not just that rules were missing, but that the whole system might be compromised by ties between local industry and officials. Is that the idea?
That's certainly how the sources present it. They cite this view that the root of the problem lies in the party's continued involvement in pricing, company management, information control. All things that can hinder real accountability.
And that connects to the censorship angle, right? The sources talk about how the media was handled after the scandal broke.
Oh, definitely. Reports of strict orders. Tone down the coverage, stick to the official state news agency script, focus on other news.
No digging into causes, government responsibility, that sort of thing.
Forbidden, according to the sources,
Huh.
which, the critics cited argue, leaves consumers dangerously in the dark. They make the case that more press freedom is actually essential for food safety.
And this pressure wasn't just on the media, was it? The sources mentioned lawyers, too.
Yes, lawyers trying to help the victims' families pro bono. They were reportedly pressured by officials. Told things like, put faith in the party and government, act together, help maintain stability, basically don't rock the boat with lawsuits.
That's quite something, interfering with people seeking legal redress.
The sources describe it as intolerable interference, something that really set back the development of the legal profession there. It highlights the system's priority, perhaps, on stability over individual accountability in these situations.
So pulling it all together, the sources seem to diagnose the root cause as this difficult mix. A fast-growing sort of capitalist economy, but within a system where the government regulation, as described, struggles to keep up or is maybe unwilling to fully regulate.
Right. And in that kind of get-rich-quick atmosphere with tight margins, the temptation to cheat, to tamper with products, it's high, especially for everyday things like milk that people just assume are safe.
And crucially, the sources show this isn't just about milk. The milk scandal was maybe the most high profile, but it's presented as part of a much wider ongoing pattern across loads of different products.
Yeah, that's a key takeaway. The sources list example after example over many years. It's not just one or two things.
Like those early ones mentioned, counterfeit booze made with industrial alcohol.
Lethal stuff. Or soy sauce, reportedly made from human hair collected from unsanitary places.
Grim. And around the same time as the milk scandal, you had contaminated fish with carcinogens, illegal antibiotics.
Infected snail meat, causing meningitis. Poisonous mushrooms.
And the deliberate fakes and adulteration just seem endless in the examples. Sewage and stinky tofu.
Painted dumplings with insecticide.
Yeah.
Organic ginger with banned pesticides. Using carcinogenic chemicals to bleach food. Fake hot pot soup base.
It's quite a list. Fake beef balls made with chemicals.
And more recently, industrial salt sold as table salt, leading to nitrate issues and iodine deficiency. Pork doctored up to look like beef, high in nitrates.
That dirt pit pickled cabbage incident got a lot of attention too, didn't it? Horrible conditions, high bacteria, preservatives.
Yeah, and even that bizarre school meal story, the object eventually confirmed officially as a rat head after they initially denied it.
It just underscores that this isn't ancient history. Even looking at recent official reports like the SAMR Food Safety Report the sources mentioned.
Right, while they say staple foods often pass tests.
Overall, nearly 3% of batches tested across everything failed national standards. That's still significant.
And the big concerns remain consistent. Pesticides, microbial contamination, too many additives. Certain categories always seem to have higher failure rates. Food service, farm produce, seafood.
And this stuff has clear international ripples. The FDA barring some Chinese seafood over PFAS contamination from polluted water. That's mentioned.
Yeah, and the comparison made in the sources to the UK finding produce from China with pesticides banned for UK farmers.
It just highlights the difficulty, doesn't it? Trying to ensure safety across these long global supply chains when you have these kinds of persistent issues reported at the source.
And like we said at the start, it's not limited to food.
Exactly. Which brings us to the syringes. The sources point to that recent FDA safety communication about plastic syringes made in China. It's another piece of this puzzle.
Yeah, this has been developing since late 2023. The FDA has been looking into reports about these syringes failing, leaking, breaking, just not working right.
Concerns about quality control, basically inconsistent performance.
That's the issue. And it could obviously impact patient safety if a syringe doesn't deliver the right dose or fails during use.
So what's the FDA recommending?
Well, based on the sources, they're advising hospitals, clinics, everyone, to try and transition away from using plastic syringes made in China, if they can.
If possible.
Right. And if you have to use them, monitor them really carefully, report any problems.
Have they taken action against manufacturers?
They have. Import alerts are mentioned against several companies: Zhejiang Longda, Shanghai Kindly, Jiangsu Shanli, Jiangsu Kaina, for quality system problems, preventing their stuff from entering the U.S.
And recalls, too.
Yes, big distributors like Cardinal Health, Medline, Merit Medical, Sol Millennium have initiated recalls involving these specific syringes, citing either unauthorized products or performance failures.
And the risk is real. A faulty syringe.
Absolutely. It can mess up dosage accuracy, especially with things like infusion pumps that rely on precise delivery. That's a direct safety concern.
Though the FDA apparently thinks there's enough supply from other places.
That's what the sources indicate, yeah, which is good. But still, having these kinds of widespread quality concerns about something as basic and critical as a syringe, it's worrying.
Yeah.
And it seems to fit the larger pattern the sources describe.
It really does. When you connect all these dots, the milk scandal, the long history of food incidents, now these medical supply issues, the sources, it points back to those same core challenges.
Yeah, the themes keep recurring. The lack of truly independent oversight, how government control might impact accountability and transparency, the economic pressures driving corner cutting, a system that seems resistant to criticism or challenges.
These things identified way back in the milk scandal analysis seem to be, according to the sources, the persistent factors behind this wider pattern.
And even when official bodies are set up, like that Food Safety Commission in 2010,
the incidents keep happening, which suggests, as the sources argue, it's more about systemic flaws than just isolated mistakes.
Exactly.
Yeah.
That idea mentioned in the sources about needing independent law enforcement within the regulatory system, it speaks to that need for real checks and balances. Without them, the system seems to remain vulnerable.
So, bringing this back to our listener, what's the big takeaway here? Why should you care about these patterns described in the sources?
Well, I think understanding this is vital because we're all part of this global market. The food we eat, the medical supplies used on us or our families, they often travel through these complex international chains. Recognizing the challenges around trust, regulation, transparency that the sources highlight, it's just crucial for making informed choices and understanding the risks.
Yeah. We've tracked how these issues, really brought to light by the 2008 milk scandal and rooted in these systemic problems discussed in the sources, regulation, transparency, accountability, they seem to reverberate through years of different safety incidents, even into critical areas like medical devices.
The sources really depict this ongoing tension, don't they, between, economic ambition and regulatory effectiveness, made even more complex by issues of information control and secrecy. So maybe the final thought to leave you with is this. Given this evidence of persistent systemic challenges presented in the sources, how should we as individuals, as businesses, even as governments, navigate these global supply chains? How do we assess trustworthiness? What questions should you be asking about where the products you depend on come from and how their safety is actually assured?